All right, thank you so much, everybody. Thanks for inviting me. Very excited to be here. I started out originally in network security, doing network security for a couple of banks in Switzerland. Really kind of got bored of that, and then thought that medicine is a field where we have a lot of data that we're not really making use of. That was really the reason I went to medical school. And at some point, my journey took me through pediatric surgery, actually. I did a surgical internship at Penn State and had the pleasure of doing a couple months there. There we go. Despite the new format, financial disclosures, I'm an employee of Google, so my presentation here is heavily biased. Healthcare of the future, built of today's tool, right? So artificial intelligence has been around a long time, but over the past 6-7 years or so, it has become a big hot topic, especially in radiology, where there's a lot of talk about replacing radiologists, and that's not why I'm at Google. I just think that there's tremendous opportunity, but there are a lot of things that we can actually do today. I'm going to take you through a little story here with Robert. Robert is a type 1 diabetic, since childhood. He is poorly controlled. He's not taking care of himself anymore. One day he collapses at home, he hits his head. He fortunately has wearable sensors, so the sensor is able to detect that he fell, and also that his blood glucose is significantly elevated. Now his family doctor, she gets an alert. She is able to organize an admission for Robert and really send him to the most appropriate hospital. So the decision of which hospital to send him to, based on the artificial intelligence tools that are built into the system, allowed him to pick the optimal hospital for his condition, which in this case is trauma. Now, Dr. Johnson, one of the trauma surgeons, she receives a notification as soon as Robert arrives at the hospital. And his case is prioritized using artificial intelligence according to his condition, the severity, and he's bumped up over other patients that may be arriving at the same time. Now, to the radiology part, he's getting a CT like every trauma patient does. But as part of that, right, using what the models already know about him, they bump up his case. So his case is prioritized because there likely is something serious going on. Now, the imaging algorithms, they identify a brain bleed. For this size bleed, obviously, you don't need a radiologist, you don't need AI. But smaller ones, right, can be also detected using artificial intelligence, ones that are actually, even for radiologists, hard to see, that frequently get missed. In the operating room, the surgical team uses AI to navigate, right, to actually remove the hematoma as effectively and reducing the risk of the surgery as much as possible. Now Robert begins his recovery. There's a sepsis alert. An artificial intelligence model detects that there is likely sepsis onset. He develops a high temperature, and we get an X-ray. So this machine learning model identifies that he has a right lower lobe pneumonia, right? And you see the red outline, right? The exciting thing about this model is it can actually tell you where it thinks this pneumonia is. He gets treated for the pneumonia, he makes a good recovery, and his discharge reports, papers, medical coding are all automatically completed, making the life for the physician, for the surgeon, a lot easier. And then, finally, his autonomous vehicle takes him home. So, healthcare of the future, powered by artificial intelligence. All the things I showed here are actually things that have been developed, that exist, that just are not deployed in hospitals today, but they could be. But when we say artificial intelligence, let's get back to the basics, right? What does that mean? Artificial intelligence, machine learning, deep learning, those terms are thrown around a lot. Artificial intelligence, right, it's really the most generic term. It doesn't even have to be computers, right? It's any artificial system that can perform tasks which are typically associated with humans. Visual perception being a big one, speech recognition, complex decision making. right? And translation. Machine learning, that's now talking about computers specifically, right? Using computer systems to learn from data that tells the computer things that have not been explicitly programmed, right? So it learns the rules from the data as opposed to having to explicitly tell the computer. And finally, and this is really the reason why artificial intelligence has become so popular again, deep learning, right? This is a subfield of machine learning where we have algorithms that are inspired by neurons, and these are very, very large. Hence deep learning, because there are so many that are connected with each other. So inspired by the behavior of biological neurons, right? These have actually been around for a long time. Late 40s, 50s is kind of when the first mathematical frameworks were developed. And when I was an undergrad studying computer science, I actually played around with neural networks back then too. The problem was very compute constrained. They were very small. They couldn't do much. Now in 2016, the neural networks of today, they are much, much larger, right? They have different specializations in different areas and are able to do a lot more. So what do they do, right? How do they do it? You show the neural network model some examples of whatever you wanted to learn, a lot of examples. Those examples have a label attached, right? So the cat is a cat, the dog is a dog. You show this network many, many examples. We're talking on the order of tens of thousands to hundreds of thousands. And it's able to learn the classification. It's learning the features in the image that make this a cat or that make this a dog. And then, once you want the classification, right, you have a trained model. You give it a picture, and the question is this a cat or is this a dog? The categories that you trained it for, it's able to make this classification even when the dog is all curled up like this. So what's different today? We were talking about Moore's law earlier, right? It's really compute, right? Before 2010 or so, these approaches were very, very limited. As compute became more available, right, and much cheaper, and some other things were tried in terms of compute. Instead of the typical CPU, GPUs, graphical processing units, are used for these. The capabilities of the neural networks much outpaced all the traditional machine learning algorithms, right? And the second part of that is that you need a lot of data. So in 2009, Fei-Fei Li from Stanford, she developed, collected a very large data set, 15 million images, called ImageNet. And that combination of the computational power and the availability of images is really what significantly improved the performance of neural networks, which now very much dominate all artificial intelligence applications today. Now, what's different about them, right? So traditional computer vision or traditional machine learning methods, you actually need to tell them what to learn, right? So you tell them specifically, I want to look for this feature, and they learn this feature. Machine learning, deep learning methods are very exciting in that regard, that they automatically learn the features, right? So whether or not you know what is the association, the deep learning model actually learns it based on all the examples you show it. Now, it may have to be a lot of examples, right? Hundreds of thousands, millions, but if there's any association at all with enough reinforcement, the neural network is going to learn it. Now, what about medicine? So one of the first areas that deep learning was applied really were medical images, right? It's an obvious application. It's very interesting at Google. Google engineers work on very large-scale things, but everybody's very excited about healthcare, right? Making an impact beyond search, making an impact beyond ads. So we get a lot of very excited engineers. And how this work started at Google was actually an engineer who went to India, and he saw a line in front of a ophthalmology clinic, and they were doing eye screening. The problem was that clinic only operated a couple times a year, and other than that, there was nobody around, right? There's a shortage of about 75,000 ophthalmologists in India. So he took the images that he was able to get, ran them through the same algorithm that powers Google Photos, got very good results in classifying diabetic retinopathy, and now that it's actually being deployed in some of those clinics in India. So what can AI actually do for providers, physicians? It's really assist, right? So first of all, it can help us a lot by automating boring tasks, by increasing quality, by increasing consistency in clinical care. I like to harp on the fact that really, despite talking about evidence-based medicine, most of what we do in medicine is not very data-driven, right? It's basically what I was taught. It's basically what my teacher was taught, very empirically. And the example that you see here is a model that we developed at DeepMind, which is a Google company. And they are doing head and neck segmentation for radiation therapy, right? Typically, that's a task that takes a radiology tech about 5 hours. This model is able to do it pretty much instantly and reduce that variability that you typically get from humans doing anything. Augmentation. This is an example of a pathology model that automatically highlights areas that are cancer. So we built this model into a microscope, and with this augmented reality microscope now, your attention gets drawn to the areas of interest that a pathologist might otherwise miss. So augmentation of what we do, I think, is a big, big promise of artificial intelligence. And then the most exciting thing, I think, is extending our knowledge, right? So those retinal images I was talking about, if you give them different labels, right? Let's say not the diabetic retinopathy classification, but age, smoking status, blood pressure, you can actually predict that just from the retinal image, right? Which no ophthalmologist has been able to explain how the models actually do that. And then even more exciting, right? I mean, sex is very easy to determine without a machine learning model. But more exciting then is some things like cardiovascular risk. Being able to predict the likelihood of a cardiovascular incident using these models actually works much, much better than our standard approaches. And that's just from the retinal images. Now imagine if you take more data points and use all of those to make predictions, right? So pathology, genotype, EHR, imaging phenotype, whatever data points we may have, and train those models for the outcomes, right? There's a lot of interesting insights and data that we are just not aware today that can be gleaned using these models. Now, what about surgery? It's a surgical conference, so we definitely need to talk about surgery. Surgery, I think, is a little bit more challenging for these models, right? Just by the nature of it. Most of surgery is not digital, right? Radiology, we now pretty much everywhere have digital images. No such thing naturally occurs in surgery, right? Except for laparoscopic videos. So using enough laparoscopic videos, right? We actually built a video pipeline at one of our sister companies, Verily, where we derive surgical insights from that video, right? First of all, very basic, is this even a surgical video, right? Imagine if you're on YouTube, looking at videos, we actually want to know that, right? And then there's a lot of other things you can tell, like how many people operate, right? Has the video been edited? How much bleeding occurs? Are the surgical planes properly dissected, right? Which surgical procedure is it? What tasks are performed? What events are happening? What is the skill level, ultimately, right? And all of these things can be predicted from laparoscopic surgery videos, right? The challenge with laparoscopic surgery videos is most people don't record them, right? So getting your hands on a large data set like this is actually very, very difficult. So this is an example of a machine learning model that was trained. This is actually by a laboratory at the University of Strasbourg. where they identified the instrument and trajectory of the instrument using this deep learning approach. And you can very easily see that this is really the first step to be able to do more of this in an automated manner. Now, don't get me wrong, I'm not saying that surgery will be replaced, right? But I think there's very, very specific tasks where the fine control of a robot combined with an artificial intelligence tool may be very useful. So, healthcare of the future built of today's tools, right? Deep learning really already outperforms humans in very specific tasks. But not all tasks are amenable, right? The models are very specific. They are very much trained for a very specific task, and they don't generalize. And the big issue, and I think that especially applies to surgery, and especially pediatric surgery, right, is access to high-quality data sets. You need a lot of data to train these, and without the data for training, there are really no machine learning models that are useful. Thank you very much.